Hi everyone, this is Mr Neel Raithatha, also known as the Wax Whisperer. Thank you for joining me in my latest video. This is of a patient who attended with bilateral blocked ears, and we're just examining their left ear. This is the worst ear out of the two, and as you can see, this is quite hairy, and you may have just spotted there, it's quite swollen as well. So this is the more difficult of the two ears, and this is the right ear. So the right ear is also blocked. You can see that they've been using a cotton swab, a Q-tip, I believe it's called in America, or what we call in the UK, a cotton bud. And the fibres of the cotton bud have attached itself to the surface of the wax. So I thought I'll just commence with their right ear first. The patient didn't actually feel that this ear was blocked. It was only once I showed them the examination clip that they realised. And that's most likely due to the fact that the left ear was so much more blocked, and in comparison to their bad left ear, the right one must have been much better. So that can quite often happen. You have patients who attend just believing they've got earwax in the one ear, which is the really bad ear, and sometimes I would remove that one first, and then only then will they notice that their better ear is actually not as good as they thought it was. So I just performed a bit of microsuction there, but the wax here is a bit drier and firmer, and although I managed to remove a little bit of wax, I saw an opening posteriorly and also superiorly here, so to the back top part of the ear canal. I'm just gliding my St. Bart's ear hook in and behind the wax, and I'm slowly bringing it through. You can see it's just got trapped at the entrance. The patient has got quite a bit dry skin, so superficial otitis externis, a bit like a bit of eczema, psoriasis. They do have some ointments, some spray, if memory serves me correct, prescribed by their GP to help with this, because it can sometimes be problematic for the patient. They can suffer from itchiness and dryness in the ear. It's a spray in the UK called Oadby, and it's available via prescription only by the GP. And it contains 3 ingredients, Oadby. It contains acetic acid. Our ears should naturally be acidic in pH, and when you've got this otitis externa, quite often the pH level of the ear changes from an acidic pH to an alkaline. So to help with this condition, a lot of these antibiotic ear drops and sprays contain acetic acid, and that re-acidifies the ear to make it more acidic. And the acidity is good because it helps to form a chemical barrier against bacteria and fungi. So bacteria and fungi are less likely to breed and redevelop in acidic conditions. So that's the reason for the acidity. Oadby also contains an aminoglycoside, so an antibiotic. It's neomycin, and that antibiotic, again, it prevents bacteria from breeding. It doesn't necessarily kill the bacteria, but it attaches to a part of the bacteria called a ribosome, and the ribosome is involved in cell replication, so the multiplying of bacteria, and it kind of inhibits the function of the ribosome to reproduce the bacteria. And finally, Oadby contains a steroid, dexamethasone, and that has anti-inflammatory benefits. So especially in the patient's left ear, which is really inflamed, the dexamethasone steroid would be very useful. So just cleaning up around the edge. There's a bit of dead skin here now. I'm going to try and remove as much as we can, but if memory serves me correct, we couldn't remove all of it because the patient was experiencing some clarinetting. This dead skin that's just lining the canal, it's non-significant. So the patient has got some treatments for this already. Most importantly, the patient can hear again, have nice healthy eardrum, you can see that in the distance. So the endoscope's only probably just over 0.5 mm into the ear canal, and the average ear canal is around 2.6 centimetres, so it's only 1/5 the way in, but even from this depth, the endoscope is able to fully visualise the patient's eardrum. So just going around the perimeter, just getting some of this scaly dry skin. I think we got a bit of clarinet, and just there, I don't know if you saw that skin, it violently flapped side to side. And at that stage, decided to stop, I believe. So the right ear cured. This is now the more tricky one, and adding to the difficulty in this ear, is the amount of hairs. Now, the patient did have quite a lot of hairs in their first right ear, but more so in this ear. Or perhaps it may also be an optical illusion because the ear canal is inflamed, so it's narrower. These hairs are more grouped together as a result, so it has the appearance of being more hairy. A common question we get asked is why don't we trim the hairs? Now, the reason for that is, although it may not make the best viewing, I can appreciate that, it's not really affecting me, these hairs being in there, because I can still see what I'm doing. Now, on certain occasions, if the ear is extremely full of hairs and I can't see what really is obscuring the views, reduced the visibility in the ear canal, I don't trim them, but I use forceps and I pluck them. It's a technique I learned from an ENT surgeon, Mr Darius Rajali, is a good friend and mentor of mine, and that seems to work quite well. If you trim the hairs, you always run the risk of these hairs flying into the ear as well, which can further mat against the earwax, making the problem even the difficulty removing the wax even more problematic. So I've managed to remove some of the lateral wax near the entrance, and now this is, you can see that swelling at the top of the ear canal, and we're just going deeper into the ear, and the suction probe only just fits in the ear canal. And as I was entering the ear with the sucker, because the ear canal's swollen around it, so when you've got swelling in the ear, you've got edema, you've got a build-up of fluid, sometimes blood, but in this case it's just fluid, and the fluid is attracted by the suction. So what can happen, you might have just noticed it there, the ear canal collapsed a bit. So as I'm going into the ear canal, because the fluid in the swelling of the cells is attracted to the sucker, the ear canal itself is attracted to the sucker, and it can cause the ear canal to collapse. So you've got to be really, really careful when you enter. So I just came back out there, slowly re-entered. A fine end suction probe can help in cases of a collapsing ear canal because there's less suction. However, it just wouldn't have been powerful enough to remove this really impacted debris. So similar to the right ear, the patient had been using a Q-tip here, and it's really squashed this wax right up against the eardrum. So we're now working on the final, probably fifth of the ear canal, so around 2 centimetres in, so we've got half a centimetre to play with. I can just about see the eardrum in the distance on the left-hand side. Around 10 o'clock, there's a little opening there. So it's just this last residual amount, but this is the part that's really causing the patient problems. So again, I'm just slowly entering the ear canal. I'm just trying to work this wax off the canal wall. It just blocked the sucker there. You may have seen me just shake the sucker slightly, just to unblock it. And you can see these hairs that are matted, and when you've got matted earwax, it can make removal a bit more difficult because you obtain less of a suction grip when you've got loads of hairs. Hence one of the reasons why I don't trim the hairs in the ears. Also, oddly enough, it's a weird, as an audiologist, I'm not a surgeon, and trimming hairs then adds another layer of insurance complexity, I'm trying to get the word out there. So, because then your room becomes potentially non-sterile, and that's, well, it's a non-sterile room anyway, but when you've got hairs in there, like an operating theatre, you can imagine, you don't really want these hairs flying around in the room, and it can add more complications. So I've not really checked that side of things. I'm assuming, as you can imagine, barbers in the UK, it doesn't really cause them an issue, but obviously barbers are not performing medical procedures, and I have been told that by trimming hairs, and they can cause other contamination issues in the room, and it just makes the whole process more complicated. So that's not a hindrance if you need to, if there is some obstacles there, and we're more than happy to overcome them for the benefit of the patient. But so that's not my primary reason not to, although obviously it can be a hindrance. It's just I don't see the need. And as you can see here, this wax is matted, it's all hairs over it, and it can make it more complex to remove. So going back to the hairs in the ears, I suspect if we start trimming them in the UK, and again, wax removal is not really regulated in the UK, believe it or not, it needs to drastically improve. But if you are a doctor or nurse in the UK performing earwax removal, you need to be what we call CQC regulated, which is, I think, stands for CQC, stands for Care Commissioning Quality. And if you start trimming hairs in the ear, I suspect audiologists would most likely need to be CQC registered. And currently, audiologists are not having to be CQC regulated. Now, hopefully that changes, and it's something that I'm looking into. I want to get CQC registered in any case, although it is no requirement. But I know a lot of nurses who have now deregistered as a nurse and who are just performing earwax removal, and that helps them to not having to get CQC regulated. Now, I've been told by colleagues who are CQC regulated, so for example, the ENT consultant I work with sometimes, that a lot of it is a lot of bureaucracy, but I think that's the times we live in, unfortunately. And so, yeah, hopefully this year, something that even though it's not mandatory, something that I'm looking to apply for. So we can see we've cleared the ear. You can see how much swollen it is compared to the right ear. I'm just trying to peel away some of this dead skin. I think I'm using the fine end there. So the eardrum's nice and healthy. So I think I just left it at that because we're getting some clarinetting. I hope you enjoyed that video, guys. Take care, keep well, and speak soon. Bye.